Health Minister Dr Zweli Mkhize has cut short his visit to field hospitals in the Nelson Mandela Bay area. The minister was on a 2-day visit to the province. Let's get more on this from our reporter Lerato Fekisi in Port Elizabeth. Very good afternoon to you, Lerato. I understand there's been a revision of the confirmed COVID-19 positive cases in the Eastern Cape. Tell us more.
Yes, I think the program of the minister didn't go as planned here in the Nelson Mandela Bay Metro. Just in terms of statistics, right now the metro is sitting at 167 cases that have been confirmed and 6 deaths, something that he also alluded on in his report. But I think what has been of concern is that he said that of these 167 cases, there were 1,000 contacts that we're trying to trace right now. But also good news was that the university, Nelson Mandela University, has said that they will make available 850 beds to isolate these people. So he said key now is to try to identify where these 1,000 contacts are in this metro, because they possibly could be positive COVID-19 patients. Obviously, these patients are coming from a funeral which was held recently here in Kwadwesi, where people got infected. And he stressed even more that we need to start re-looking, especially within our African culture, how we do funerals. And it's something that he's addressing currently with the MEC of Health, who has drafted a proposal to re-look how funerals are done even post the lockdown. He also talked about the shortage of PPEs, saying that he has deployed the DDGs from National Health to come and actually be stationed here to form a multitask team that's going to see how do they curve and drop the numbers of the positive cases here in this area. He said this DDG will make sure that, number one, hospitals like Dorangines and Livingston, who have been protesting over PPEs, are now on the fast, on the number one and getting these PPEs. He also spoke about the shortage of staff, which is an issue that has been long going even before the COVID-19 virus, that they're going to start now bringing unemployed nurses back onto the scene. They're also going to train more nurses, also going to bring more nurses and more doctors now on the scene. So it's not really yet sure exactly why he cut his short visit. We are aware that he was supposed to go Ezwit and Asedwesi, but he decided just to have literally out of the moment briefing with the media, and then decided just to head off. But I could really say he was, unlike he was in East London, where he could really say, I'm pleased with the report brought forward by the Minister or the MEC of Health in that area. I didn't hear him utter those words in the metro, and from what I looked at, he seemed a bit disappointed, as if he's looking at a metro that's not really organized, a metro perhaps not really has their ducks in a row, which is quite alarming when this metro is actually the epicenter of this virus.
About what you're seeing when you're moving around in the area in terms of social distancing. I can hear what sound like a few cars driving past you, and how people are conducting themselves there.
I think it's a coin of two coins, really. On the one side, you have people, especially in the urban areas, who are really complying. The streets, here are really pretty much empty. But then if you go to the townships, especially like Dwesi, in New Brighton, where people have already said, would love the media to come here, the minister to come here, and just take a look at how business is as usual. People are walking around, not really concerned. And it is really worrying, because our highest numbers in the metro are coming from the township. And if people there are not compliant with the regulations, will the numbers here in the metro go down if people are not even doing the basics like social distancing, the base like keeping to their homes during this time of the lockdown?
So, Lerato, you said that there is a concern by some residents, so there's obviously awareness of what's taking place. Do we know why the people who perhaps aren't complying aren't doing so? It's really hard to say why people aren't complying. You're not looking at a township where people are staying in shacks and perhaps don't want to be in their houses because they're so small. I think the better part of our townships are really properly good RDP houses that are not necessarily big, but people can stay inside them. But I think people are just casual. People obviously want to go about their normal routines, walk about in the township as they were before. So I think the awareness is there. If you post on social media that the numbers are this high, people respond and say, people stay at home, I'm scared. But when you go to the streets, it's a different case. People are walking around despite the rising numbers. So I think it's just a blasé attitude, from people in this metro, because they are aware of the dangers of this virus, but want to do things the way they're doing them before the lockdown. Lerato Fekisi giving us an update from Port Elizabeth in the Eastern Cape now. Thanks for that.